Hi, my name is Johnny Ross, and I'm the founder and CEO of MedHab. I'd like to welcome you to today's conference call talking about long-term care of your patients and fall prevention. Today's facilitator is Vicki Tilley. She's a geriatric clinical specialist. She's the owner of ElderFit Physical Therapy and Consulting Incorporated. She's also a consultant to MedHab. As a disclaimer, I'd like to let you know that some of the information that we found today relative reimbursements is geographically specific. So the dollar amounts that are shown may or may not be applicable to your area, and we advise that you check with your plans before setting off on your reimbursement and putting the codes out there for your patients for these services. Today we're going to we basically introduced ourselves already. We'll go over telehealth and some considerations with telehealth. We'll talk about MyNotifi, a product that will help you take care of your patients in the long term. OTAGO, which is an exercise platform that's clinically proven to mitigate falls by as much as 46%. And of course, the thing near and dear to everybody's heart, while you're taking care of your patients, can you get paid for it and how to do so? And then we'll talk about working with and without doctors, because there's options on that, and then a call to action. Without further ado, I'd like to turn it over to today's facilitator, Vicki Tilley.
Hi, thank you so much, Johnny, and hello everyone who may be joining us today. Just to give you a little bit more of a background, I am a physical therapist and have had a private practice for close to 18 years working with older adults in their homes. So using and working with people on fall prevention is something that's near and dear to my heart. As a private practitioner, we have all been talking about what we might do with telehealth. And prior to the pandemic, COVID-19, telehealth and telerehab had been developing gradually within the physical therapy profession as a way of delivering care, mostly being approved to start working with people in rural areas where they had difficulty with access to services, and was being reimbursed a lot by private pay, people that were willing to pay privately because insurance would not reimburse for it, and it was not covered by Medicare and the Medicare Advantage plans. So what we have found because of COVID-19 is that we have had a complete shift in what's happening under telehealth and telerehab. We've had medical clinics and rehabilitation clinics either closed or had significantly had to reduce who came into the clinics because of shelter-in-place orders to reduce the spread of the virus. And so what's happened is many hospitals and clinics have transitioned to using telehealth and telerehabilitation to keep people in their homes and to try to keep them out of risk. So with this, before the health crisis, reimbursement, as I said, was poor, especially for the older adult population. But because of all of the shift to telerehab, we have seen a lot of change in reimbursement for therapy services. First, there was a gradual transition of the Medicare Advantage plans covering telerehab state by state. And then with the passage of the CARE Act in March and the 1135 waiver, we originally saw expansion to allow us to do e-visits. And then at the beginning of May, there was a full expansion of telerehabilitation coverage under Medicare, which for physical therapy, occupational therapy, and speech. And so now we can provide telerehab services and covered by Medicare. Go ahead and advance, Johnny.
Okay.
And so what kinds of opportunities is this presenting us with? First of all, we're all trying to figure out the best way to provide telerehab in our clinics and the right patients that this is going to be appropriate for. We're having to figure out the best type of patient-facing technology, considering eventual HIPAA compliance and all the privacy issues and simplicity for our patients to be able to access it. And we're trying to figure out who benefits from telerehab and who won't. especially we're kind of seeing is somebody is working with older adults who has access and can manage the technology, and who may have trouble with that. And we're also using it and trying to figure out how we keep people engaged in therapy services. So how do we continue to help them with exercise programs? How can they access technology that might be able to allow them to see patient exercises? We are understanding that under telerehab, some of the contact doesn't have to be in real time, but can be a review of cases, which then we can do follow-up communication with at your convenience or the patient's convenience. We're also finding that there are probably ways that we can start using telerehab to help people transition into wellness programs with potential monitoring through some remote monitoring ways. So these are all things that are current opportunities and could be potential opportunities for us. Go ahead and advance, Johnny. And so what are some considerations as you're thinking about doing telehealth and telerehab in your practice? So what are the most effective ways to start telerehab? Again, it's looking at your patient-facing systems interfaces to be able to talk with your patients. A lot of people are using interfaces like Zoom and some other free HIPAA-compliant interfaces. And what happens when the 1135 waiver is discontinued? This is something that currently is a real possibility, because when that waiver is discontinued by the federal government, potentially telerehab wouldn't be covered under Medicare anymore. There is a lot of activity underfoot right now in Congress to try to make sure that these expanded services will be continued benefits once the waiver is discontinued. And what other things can we maybe build into what we're doing from a telerehab standpoint as we move forward? Is it a great idea, and can we use remote monitoring to help us with the care of our patients? And then if we do remote monitoring, then we can get information like, how is the patient doing? Is the therapy working? Is the patient able to follow directions and following up with the recommendations that we have? Does the ability for the patient to put some input into what they're doing help to create some accountability for the patient? And are we seeing changes over time where the patient for some reason doesn't do as well, or we find that they've had a fall because they're wearing a fall prevention or a fall detection device, and we get that information. So as we're looking at telehealth and telerehabilitation, how can monitoring devices be a part of the care that we deliver and a support for patients in between our visits and as they're looking at doing more on their own? So Johnny, I'm going to turn it over to you to talk about the MyNotifi device.
Sure. Thank you, Vicki. So, MyNotifi RX, as you see here, it's an app-driven device. It can be worn interchangeably on the wrist, the bra, a shirt chest pocket, or even on the belt with the belt clip that we provide. You can see a photograph of it here, how it's shipped. It comes with the charger. And here's the wristband itself, and it has an extender band if it's needed for ankles. The app is a very, very easy user interface. We made it so that that way your patients can get into it and use it very simply, and walk through the exercises that you select for them. There is an automatic fall detection algorithm, and on top of you being able to manage your patients with the device and like looking at that data long term relative, how they're moving, range of motion, speed of motion, overall compliance. They can also select as many family caregivers as they wish to be there in a time of need. So if they fall or if they're just feeling terrible and they need some support, their family would be summoned And automatically, if they fall or if they need the help, they can push a button or touch the app, and it will send a message that requests for help. It could be, as few or as many people as they want. It could be a neighbor of, however long, grandkids, whomever's there. Everybody gets that message simultaneously, and it is HIPAA secured because the device is a Class 1 FDA regulated device, and it is exempt. It is HIPAA secured, and it meets FCC regulations both in the US and in Canada. So everybody gets those messages at the same time, and they can be there to support mom or dad in the event of a fall or other need. As again, while that's going on, you're on the other side of the house managing everything else that needs to work, that you're looking for as far as range of motion and strength that would offer you those good positive discussions with either the device, the user of the device himself, or the family member. So it's pretty simple to use. We already said it connects to a smart device. If there's not a smart device, that's not really an issue because we do have a gateway that we've developed. However, if they don't have a smart device, the exercises that they need to do, they cannot do those. However, they will be connected and be protected in the event of a fall. Unlike other devices on the market, this is not an every month $30 or $40 or $50. It's once it's paid for, it's done. There are no monthly fees, no call centers, and there's even a potential for Medicare to reimburse for the device. I'll let Vicki talk about that a little later. But the two things I'd like to point out on this sheet here about MyNotifi RX are the two in green. One is that it's preloaded with the OTAGO exercises. And as I mentioned earlier, those exercises can mitigate falls by as much as 46%. And Vicki knows more than anybody about OTAGO, so I'm sure she'll tell you a little bit more than I can tell you. The other thing about the device, it's also preloaded with about 38 mobility exercises. In fact, as we speak right now, we're adding 20 more for the upper extremities. So there's a lot of good exercises that are all American Physical Therapy Association approved, from which you can choose to manage your patients to make sure that they're doing what you want them to do for their strength and balance issues that they might have. So here's how it works. It's pretty simple. First of all, it's waterproof. I already talked about where it can be worn. So in the event of a fall, what would happen is the device would start to pulse vibrate, or the app would tone, and it would actually say, MyNotifi detected a fall. Did you fall? One or the other is going to happen depending on which model that you're using. And to stop that, you would either push the red button or touch the app, and it turns off. And once that turns off, it automatically sends a message to the family of caregivers. And the reason why you're saying, oh, it turned it off, sure. The reason why we do that is because that way the family of caregivers who are responding, they know that the fall occurred. They know mom or dad was awake when that occurred. And it's important to understand that. However, in the event of a fall where it may be more violent in nature, perhaps they're incapacitated or unconscious, that's okay. The device will wait exactly 1 minute, and then at that time it sends an escalated message. If the user's not able to respond, it sends that escalated message to the family, and they know that mom and dad may have fallen, they weren't able to respond, and they could be in dire trouble. As well, because smartphones or smart devices have GPS, if the user of the device is out, maybe at the park or whatever they may be doing, if something were to happen there, you would know exactly where they are if they're not in their home. Last but not least, it's not only about falling. There will be many times when patients may need some support. I mean, who knows what? Well, you would know what comorbidities they have, but maybe they have a heart condition or something, and they can't breathe, or maybe they have they may went to lie down, they can't get back up, and they need help. Touch the app, touch the device, one or the other, and it's going to send that request for help directly to the family. And again, the beauty of it is that everybody in the network sees the support that's needed, and when somebody responds on there about going over to help mom or dad, everybody in the network knows that. So everybody knows help is on the way to make for better coordination of care for mom and dad outside of the clinical office. And again, as I said, you can designate as many people as you wish to be on that network in the event fall occurs or any type of request for support. Vicki, I'll turn it back over to you because I'll let you talk a little bit about OTAGO.
Okay, great. So one thing that is really helpful with the MyNotifi application and the wearable device is that the patients can use and input information into the application if they are doing exercises that you're prescribing as part of the OTAGO exercise program. And what is that? The OTAGO exercise program was developed in Otago, New Zealand by Dr. John Campbell and Dr. Claire Robertson. And it was implemented and studied in the mid-1990s. And as Johnny said, it was proven to reduce falls and fall-related injuries in a high-risk older adult population by 46%. What was unique about it is that it's an individualized program done by patients in their homes. And it's a group of about 17 different exercises that were put together and with a set progression of the exercises. And it was developed for physical therapists to instruct the patients and then to monitor the patients for, the original study was up to a year as they were doing their exercises. A majority of that time, the patients were supposed to do it independently with periodic check-ins by the physical therapists. It is an appropriate exercise program for people who are more frail and who may not be able to go out and do a community-based group fall prevention program like Tai Chi or Fit and Strong or Matter of Balance or some of the others that are more community-based. It's also something that could be really appropriate right now because of COVID-19 and the fact that we are seeing more people in their homes. Go ahead and move to the next slide. So the OTAGO program was brought over to the United States and implementation was approved by the Centers for Disease Control because of its effectiveness in the original studies. And so we originally tried to implement the program in the US as it was developed in New Zealand. But because of our healthcare system, which is different than the New Zealand healthcare system, we found that the monitoring of somebody for up to a year was kind of difficult. So we did make some modifications trying to maintain fidelity. And so the modifications include definitely the evaluation by a physical therapist with determination of the exercise prescription, and then that person could be followed by a physical therapist assistant, or if this is being done through a cooperation with a granting entity out like the Area Agency on Aging or something like that, it could be another exercise professional who's consulting with the physical therapist. We also have the model where a patient could participate in a group and do the exercises in a group once they'd been evaluated by the physical therapist and the exercise prescription had been done. Our model in the US is that the PT would see a patient for a period of about 5 visits over 8 weeks, and then would be monitoring the patient for potentially 6 months or even up to a year if you're in a model where you're doing some remote monitoring for wellness and maintenance. So that's the general model for the OTAGO program. There is a certification program that you can do. So you can become OTAGO certified by going to the Carolina Geriatric Education Center, and that's an online web-based program which you can take at your own pace, and it's a really inexpensive program, only about 3 hours long. And on the same website, there are resources, the patient manual, exercise pictures, and exercise videos. So a patient can see the exercises and link to the videos. And these are actually built into the MyNotifi application so that the patient themselves can see these pictures and link to those videos, which is a way to help the patient learn the exercises and have that resource when you're not there. go ahead and advance. So how would we think about we're using MyNotifi to support care of the patients, and with this, how do we think about reimbursement? So there are a couple of different ways that you can bring MyNotifi in to support what you're doing from a patient care standpoint. The first model would be using it as a part of your therapy, of providing your therapy services. So you're just kind of integrating it right into the sessions that you're doing with the patient. You would teach the person how to use MyNotifi, how to get into the application and enter their exercises. You would be registered so that you'd be able to look at a dashboard to monitor what they're doing. And then that way you could pull the exercises up into the application so that they could actually check off that they did them in between the sessions. That way you can monitor compliance between the visits, use it to help you send maybe encouraging messages to the patient, or when you see them for a visit, to say, hey, you know, I noticed that you've been doing the exercises. That's great. Let's keep it up. And you as a therapist are being reimbursed for this care as part of your therapy under the traditional treatment codes. So we'll go over what those codes are in a little further, but this is just part of your treatment services with the patient. Potentially, you could also use e-visit codes. Again, we'll go over what those are a little more specifically, but those could be codes that you use for monitoring how someone is doing in between your visits. Johnny, go ahead and progress it. The second model is something that is, which is something we would like to work towards. It's currently not reimbursed if you're a physical therapist in private practice or an outpatient clinic. This may be reimbursed if you are working in a practice which is owned by a physician. So there may be situations where if you're in that kind of practice model, you could start doing this now. But also, this could be something that we're able to do even in outpatient private practices in the future. And this is more of a wellness support type model. And what it allows is that we would be able to use this device to do some monitoring, remote monitoring over an extended period of time. And Medicare has specific codes that are available currently to physicians, which are remote monitoring codes. And there are remote monitoring codes that have been written that non-physician providers can use, but at this point in time, no money is tied to those codes, which is why physical therapists in a private practice or an outpatient setting can't bill Medicare for these codes and get paid for them. You can use them to help you track your time if you are doing remote monitoring or contacting the patient, but we just can't get paid for it. In a physician's office, a physician's practice can get paid for it using remote monitoring codes. And so this is something that if you were partnering with physicians in your community and you wanted to help a patient get a MyNotifi device, this is a way you could talk to a physician practice about a partnership where they used MyNotifi to do remote monitoring from their standpoint. Your patient was able to get the MyNotifi device for fall prevention, and a physical therapist in a private practice could use it to get them doing the exercises at home, and you're tracking the exercises and using it as a part of your therapy practice. In the long run, the American Physical Therapy Association is advocating to get remote monitoring codes covered under Medicare and Medicare Advantage plans, and would be a good resource for you to contact to find out more information about the use of these codes. If you want to go ahead and progress, Johnny.
Sure. So, obviously to help manage this, you have to have appropriate dashboards so you can view those and from which you can make clinical judgments and have productive discussions with your patients or perhaps the family of your patients. So here what you're seeing is a simple screenshot right there of the OTAGO provider dashboard. And it says the status, if they've completed it, it's time-stamped as to when, time-stamped for the duration of time that they, on each exercise. And as you can see, you can have multiple pages. This is a static screen, but there's up to 17, there are 17 exercises in OTAGO. I don't think you would normally have a patient doing all 17. You pick and choose which ones are the most appropriate, and they would be listed here. And you could be able to click on any one of those and see the history of their compliance and of what they're doing with the exercises, if that makes sense. As well, as we mentioned, there's about 38 American Physical Therapy Association approved exercises, and we're adding 20 plus right now for the upper extremity. But these are the exercises that you can actually monitor as well. You can select whichever exercises you want, and graphically represents it as well. So in this case here, this caption with external rotation here, you see the amber color is the right arm or the right extremity. In this case, it's the arm. And then the blue is the left, and it shows here the date and time of the exercises were performed, the speed in milliseconds, the repetitions that were achieved, and the degrees of motion. So if you click here on speed, reps, or degrees, in this case, it's already selected on degrees. It shows you here that this subject with the left arm had roughly about a 30% better range of motion on the left arm than on the right arm. And, I think those things are going to happen. I'm not a clinician, but, I think if you're looking at a line graph going across like this, that's probably not a bad thing. But if you start to see one or the other decay or degrade, then something's going on that could lead to a productive discussion. Same thing if you're seeing the inability to meet the desired repetitions, or even if the exercises are slowing down drastically. There's something that may be going on with the patient that would be an opportunity for a discussion. Vicki, I'll turn it back over to you. Talk about what's near and dear to everybody, and that's how do we get paid for these services?
Yeah, and this is an ever-changing topic right now because of the pandemic and things that are changing under Medicare and the Medicare Advantage and state plans. So at the outset, I would recommend, and on the next slide, there'll be some resource sites for you to go to. But I would recommend that you stay on top of what's happening within your professions. But as we talked about, if you're going to use MyNotifi with your standard treatment as far as teaching people exercises and then using the device to help track how someone is doing and encourage them with exercises in between sessions, then we're going to use our standard 97,000 series codes under Medicare in the outpatient realm. So that's 97161 through 97163. Which are the evaluation codes, which are based on time. And then your 97164, which is the reevaluation code. Again, that's based on time. You can bill these for one-to-one face-to-face visits, like in person. You are also able to bill them under telerehabilitation as virtual visits. And then I'm going to say you want to make sure you're using your best clinical judgment if you're going to be doing some virtual assessment and having anybody do something which, because you're checking your balance, which might put them at risk. So these are conversations and things that are being kind of discussed and thought through right now, but I would recommend that you use your best clinical judgment for that. Go ahead and progress the slide. And then for standard treatment, under OTAGO, we generally use the 97530 therapeutic activity codes, 97110 therapeutic exercise, and 97112 neuromuscular reeducation for balance. and use these codes. They're all time-based codes, and so you would be using them to track whether you're helping somebody with a walking program, teaching them the strengthening exercises, or teaching them the balance exercises that are included in the OTAGO program. So again, these codes can be used whether you're seeing somebody face-to-face in person, or whether you're working with somebody through a telerehabilitation model. You can use the same codes, billing for the same amount of time, and they're seen as the same under Medicare and many of the Medicare Advantage plans. So these codes, again, there are several Medicare Advantage plans, several states that have already said that they're going to continue paying for telerehabilitation even after the COVID pandemic is finished. We're advocating for the similar type of statement under Medicare. So please follow this through the American Physical Therapy Association and the American Occupational Therapy Association, because they are advocating for this. And there's a link. There is a lot of information that can be found on the APTA website about how to provide telerehab, the things you need to set up, all the legal things you need to consider, malpractice insurance information, and how reimbursement works. So that's a great place to go to find out, as a start, to find out a lot of information you need for providing telerehab. Go ahead and progress one more. So something that was new at the beginning of COVID-19 was the ability for physical therapists and occupational therapists to do e-visits. And e-visits is a way to communicate and stay in touch with a patient in between visits, which are remote contact. So Medicare approved these visits initially to help us keep in touch with our patients as they were beginning to want to stay home more and not come into a clinic. So this was the first way that we were able to provide some telerehab services. And the ability to do an e-visit is still available. The way that an e-visit works is that it's a digital communication. So right now that can be by phone, it can be by like a phone-based application, FaceTime, but the recommendation is that you want to develop some sort of HIPAA-compliant interface. And the patient has to request this visit. So the patient needs to send a voicemail, an email, a text message, or something that lets you know that they want to have an e-visit. And the therapist is able to let the patient know that this type of visit is available to them, but then the patient needs to initiate the visit. Once you set up and have that first visit over the phone, and these are meant to be quick consultations, like not a full treatment session, but just a consultation to answer questions, to maybe help with the progression of an exercise, to just check to see if the patient is doing something correctly, something that needs your skill but is not like a full treatment visit. And so these codes are based on time, and it looks at a cumulative time over 7 days. So the 7 days starts when you set up the first e-visit with the patient, and you could have several in a 7-day period if that's what the patient needs. And you would track the total time. So the first code, G2061, is going to be for a shorter amount of time, 5 to 10 minutes cumulative over that 7 days. G2062 is for 11 to 20 minutes. And then G2063 is for a cumulative time of over 20 minutes. So if you end up being on the phone with somebody 20 minutes or more in a 7-day period, then you're going to bill that last code. And again, the money amounts may change based on your location, but you can see it's not a whole lot of money. But it is something to help you account for that time, answering questions for the patient and keeping in touch with them. So that's something that you could be using with the MyNotifi device as you're helping to monitor somebody at home. You could use this as a kind of a phone consultation or virtual consultation just to make sure that everything is going okay in between visits. Medicare has also said that we can do e-visits over consecutive day periods. So you could have one 7-day period, and then you could end up doing it again over another consecutive 7-day period. So that is okay right now under Medicare. Again, information about e-visits is on that telerehab page on the APTA website and also on AOTA website. So those are two really good resources. Go ahead and progress, Johnny.
Sure. All right. Well, Vicki, thank you very much for all that great information on the CPT codes, the G codes, the 97,000 codes that are there for reimbursement purposes for long-term care patients. So let's talk a little bit about pricing and payment for MyNotifi RX. As we know, Vicki, I know you're doing a lot of work, regarding with the APTA about trying to get physical therapists to be able to bill the RPM codes, and hopefully there'll be success through a lot of advocacy over the next 6 months or so. But until that time, there are 3 different options for you as a physical therapist. So as you can see here on bullet number 1, the price point for MyNotifi RX is actually $349, meaning that's what Medicare will pay for the device over time through the RPM program. So since that's not available to you directly right now, there's 2 other options. That first option would be that we offer MyNotifi RX on a contracted price to all physical therapists for just $219. And in such, you're able to put that device on your company credit card or your practice credit card, pay for the device, and then you can mark up the device, for the patient. And that's just dependent on what your market can bear. But you can mark that up to $349. So you might make somewhere in the $40 or $50 profit margin. You can make up to $120. Again, only you can make that determination, but it's simple. You would just go online, put your credit card in there when you prescribe the device, and put your credit card in, and you get it for that price, and then you mark it up. Option number 2 would be that if you don't want to do that, and that's okay, your patient can then purchase the device for $299 on a one-time purchase. And if they're not able or willing to do a one-time purchase of $299, the price can be split up into 4 equal payments. However, the price then is $349 because we're carrying the note, and that's a 4-month lag on that revenue coming in. So either way, whether you do it or if your patient does it, it's a simple credit card transaction that's done on our secured website. It's your call on how you want to do it. And of course, the third option, as I started with earlier, is through the RPM program. If you are working with a provider and a doctor that is really practicing RPM, then the device can be paid for through Medicare. There's no cost to your patient, no cost to you, nor is there any cost to the doctor, because they're being billed for that monthly, the $62, and Medicare is paying that $62 to them, and then they, in turn, write that check based on an invoice back to us. So 3 options are available. You pick the way you want to do it. We're happy to help you either route that you choose.
Vicki, do you want to take this on? Or you want me to continue here on this one?
You can go ahead.
Sure. Okay. So I kind of already talked a little bit. Yeah, so I thought I kind of went a little bit ahead here. But if we've already talked about if you're working independently or with a doctor, you communicate with that. And if the doctor doesn't know a whole lot about the RPM program, they can certainly give us a call, and we will get them coached up real quick, because they're going to hear a lot about this as this unfolds. I mean, the RPM program is pre-COVID-19, matter of fact. I mean, really all these codes came out in 2019, and they started taking off in 2020. And then all of a sudden COVID hit, as Vicki explained, and it kind of blossomed from there, and other things are starting to open up, which hopefully will stay around, and that's yet to be determined. But again, if the patient cannot afford it, or they say, no, I don't want to pay for that, then the best option then is to work directly with the doctor, because the code 99454 takes care of that at that point in time. I think that's a pretty simple thing at that point. I don't know if I need to continue on that. So it comes down to the call to action and the close here before we, let you know if you have any questions, you can send them to us. Actually, the best place to do so, I don't have it listed here, but it's support@medhab.com, and that's MEDHAB, support@medhab.com. You could call us there at 800-541-1420 for any questions that you have. My team is there to help you. They're not there to sell you on this. They'll answer any questions that you have. If you'd like to register an account, and what that means, you're just simply setting up the ability to use the technology. You'll need your NPI, because we do actually send that to Medicare to make sure that anybody that's using this technology and part of the, whether or not you're part of the RPM program, is in good standing with Medicare. You can also go to MyNotifi.com. You can learn more about the retail aspects of MyNotifi, because there are two products, MyNotifi, which is strictly retail, but a lot of the features that are built into MyNotifi are similar to MyNotifi RX. The difference is the RX module gives you as the provider the opportunity to work with your patients with OTAGO, most importantly, as well as manage those other exercises on an ongoing basis and receive reimbursements for it. The patient too would, once they get the device, they would register, and that's how everything is made so it's HIPAA secure. Matter of fact, even when they reach out to their family and friends to be caregivers to them, their family and friends would download the app for free, and that connection is how it's made securely. So everything is sent as, you don't have to worry about this going into cyberspace and everybody hearing it, or seeing it, I should say. And again, using the app, I mean, it's easy for you as a provider. Once you go through our trainings, it's so easy to help the patient, pair and register, pair and connect to the device. But we do that as well. Once they get the device, if they can't do it on their own and they need your help, great. Otherwise, they can call us at the 800 number. We will help them. Our commitment to you and to the patients, by the way, is that there's no cost. Some organizations, after a while, they'll start charging you for service calls. We're not going to do that. If you or your staff that's implementing this program needs our support, call that number and we will take care of you. Same thing, if a patient calls you and there's something that you may not be acutely aware of with the device or what have you, that's okay. Have them call us, we'll take care of them. Okay? With that said, I'll turn it back over to Vicki for any closing comments you might have.
Thanks, Johnny. And I think I just want to close to, first of all, say that from a fall detection device, I think this MyNotifi is a great option for a lot of patients because of the flexibility of where they can wear the fall detection monitor, and the fact that it's a one-time payment. They don't have to pay a monthly subscription fee for it. And it's something that they can communicate directly with their family or whoever the best person to contact would be. Then you've got the added option and benefit of being able to use it as part of your therapy practice to help encourage them to do exercises in between, to track it, and then potentially to do ongoing monitoring, which I do believe is where we're going to be heading in the future as far as continuing to be able to track how people we're working with are doing to help them stay well, healthy, and prevent falls in the community. So I'm happy again to if you want to contact me, you can just get in touch through Johnny. He can send you questions that you may have for me, and I'm happy to answer them.
Yeah, so look, that email again, I mean, you'll find it if you go to mynotifi.com or medhab.com, but it's support@medhab.com. Any questions you have, we'll make it our way and we'll get it to you. But before we close, just one last thing that I do want to draw your attention to. If you take a look at the bottom of the page, And it talks about the RPM program and not just code 99454 for the device, but there are different codes that the providers can use as well. So in the event, if you are not, if you're going to be working with a doctor and they're doing RPM and you're taking care of the patient in your office, if that's the model to help the patient, the benefit to the doctors as well, due to all the different 99,000 codes and PCM codes that they have available to them, they can actually generate, somewhere close to $200 per month on their end to help and, take care of this. So there's an incentive for them to want to do this, to support you to take care of these patients in the long term. Again, if there's not reimbursements for both parties, it's not going to work. And that's why RPM was put together by Medicare in the first place. It's to help our patients, our seniors from falls and other problems that they may have associated with mobility. And we're now in a situation to do that. So with that, I want to thank you for your time and hope to support you in all of your needs with your patients in the future. Thank you very much.